My name is Jacob Fiene. I'm the manager of medical resources for LCMS World Relief and Human Care. Just recently, I returned from a Mercy Medical Team trip to a town called Jimani, where we worked in a clinic called Good Samaritan Clinic, which was actually converted into a hospital in order to handle the influx of patients coming in from Haiti who were somehow physically harmed by the earthquake. Well, we saw a lot of fractures, a lot of internal injuries. A lot of people were very much traumatized. Our team consisted of 11 medical professionals. We had a surgeon, 2 physicians, a combination of registered nurses and nurse practitioners, as well as a nurse anesthetist. When we arrived on Tuesday evening, the hospital was in desperate need of our staff. We ended up basically taking over operations at that point at about 11 o'clock p.m. and our staff worked until about 6 or 7 in the morning. We walked into a situation that was very chaotic. There was not much in way of organization of the personnel. The first night we had 3 registered nurses responsible for close to 150 patients who were either waiting to be operated on or were receiving post-op care. As the time went on, the situation improved drastically. Many resources were coming in, a lot of volunteers. It was very much an international effort. People from all the way from Spain to Puerto Rico, all throughout the U.S. We were really coming together and working together well amidst the chaos. Generally speaking, the patients were being flown in and were being treated in the hospital. The issue that we faced as time went on was that there was no clear answer to where the post-op patients would be going. We couldn't just drop them off in Haiti because they would obviously need follow-up care. So after a few days, the hospital was able to identify a facility or 2 in Haiti where we began discharging patients. Unfortunately, amidst the chaos, the mortality rate was relatively high. However, where we were working, the mortality rate was much lower than in some areas where the public hospitals were treating people. They were sending people back to Haiti virtually a few hours after their surgery, and these individuals were experiencing a mortality rate of around 50%. Generally speaking, our team did a wonderful job. They jumped right in. They worked long hours. Many of them went without showers, without the normal luxuries of life. We got by on simple food and water, and it was hard for a lot of these individuals to leave after they had grown attached to their patients. I think what really struck me during my time was the strength of the Haitian people, to see them care for each other as they did, to see people who were injured themselves taking care of those who were in more dire situations. It really gave us the strength that we needed to continue on in such a fast-paced environment. There are many stories that we could share, many personal anecdotes by these individuals who were affected, and but most importantly, I think that they were able to see that there are those who care for them and that there is help on the way, and for that I think they were infinitely grateful.